Bronchiectasis is a long-term condition where the airways of the lungs become widened, leading to a buildup of excess mucus that can make the lungs more vulnerable to infection. Clinical features include persistent and recurrent cough with purulent sputum production, repeated chest infection, coughing up of bloods 50 to 70% of all cases. Systemic symptoms like fatigue, weight loss, and myalgia, or known as muscle aches or pains. Chronic cough and sputum production. Treatments for bronchiectasis. Treatment aims to prevent further damage and infections and reduce your symptoms. You will have maintenance treatments which you take regularly to reduce the number of infections you get and keep yourself well. Treatment for flare-ups or chest infections include antibiotics, clearing your sputum or your chest regularly, relieving breathlessness, and vaccinations. There are a number of things you can do to help relieve the symptoms of bronchiectasis and stop the condition getting worse. These include appropriate airway clearance techniques by a specialist respiratory physiotherapist and advice of the frequency and duration with which these should be carried out. People with bronchiectasis to have an individualized written self-management plan. Stop smoking. If you smoke, vaccine every year, regular exercise, keeping yourself well hydrated, and have a balanced diet. Flu vaccine every year is essential. Anyone in this risk group is more likely to develop potentially serious complications of flu, such as pneumonia, so it is highly recommended that they have flu vaccine every year to help protect them. Anyone aged 65 and over. Regular exercise is important. Home exercises. Walk everywhere. Walking is one of the easiest ways to get more activity into your day, lose weight, and become healthier. Research shows people who fit moderate activity, such as walking, into their daily life burn more energy than those who make weekly visits to the gym. Try to fit walking into your routine by not using the car for short journeys. Walking all for part of your journey to work, getting off the bus or train one stop early, and planning longer walks at the weekend. Self-management plan. You know your symptoms. If you're feeling generally unwell, coughing up more sputum or sputum more sticky, worsening color of your sputum, worsening breathlessness, that could be an indication of chest infection. During your chest infection, clear your chest more often, at least twice a day. Take your medications and inhalers. Drink plenty of fluids. Collect sputum sample and hand to your doctor as soon as possible. Some colds get better without needing antibiotics. If there's no change in the amount of color of your sputum, do not start your antibiotics. Seek help if needed. You need an urgent review from your doctor if you're coughing up blood or chest pain when breathing in. Collect sputum sample and then start the antibiotics recommended immediately without waiting for the sputum result. It is an emergency if you have chest pain, more breathless, and coughing up large amounts of blood. Know when to seek help.